Okay, we're gonna get started. Wonderful. Yes, brief introduction. If you haven't met me before, this is Dr. Bunmi, and I just wanted to introduce myself and share with you some very, very important information on our schedule. Just trying to give a quick training on what the schedule in our practices look like and how we expect our virtual assistants and all of our office staff to make appointments. I'm just going to walk you through what this typical schedule looks like and what you can expect. I'm going to be using one of our offices and I'm going to log in for you right now. So I'm going to log in. And honestly, our schedule is the lifeblood of our practice. We take our schedule very seriously. And I think it's very important that the team is on the same page on what the schedule should look like and what are our expectations when it comes to how we handle the schedule. Right now, the office has just one doctor, Dr. Bumi. But honestly, even if we have multiple doctors, the schedule is going to take almost a similar fashion. Now, our schedule typically runs from 8 a.m. in the morning till about 5 p.m. Lunch is usually from 1 to 2. Our structure of our schedule has two dimensions to it. There's the length of the schedule, meaning that what time do we start to see patients and when do we stop seeing patients and when do we have some time for a break. So our schedule should have a length in terms of how when we start and when we stop. And our schedule also has a breadth, meaning how much can we accommodate within those times. Our goal is to maximize every single minute that we have on the schedule, and we want everybody to be able to visually look at the schedule and know where everything fits. So I'm going to get right to it. Let's talk about the length of our schedule. Then we'll talk about the width and the capacity of our schedule. In terms of length of our schedule, our day starts at 8 o'clock, meaning that we schedule our first patient for 8. We typically will have a lunch between 1 and 2 o'clock, okay? And then we do a afternoon session from 2 to about 5. When you do the math, that means we have 8 hours of maximum production. First patient at 8, lunch between 1 and 2, last patient from 2 to about 5, last patient from about 5 o'clock. That's the schedule we're going to run for today. If for any reason we need to increase the length of our schedule, we will inform you and you'll be aware of it. But for right now, we'll keep it simple. We run a day that starts from 8 and ends at 5 with lunch between 1 and 2. Now, how wide do we make our schedule? Visually, to make it simple for you to understand, I want you to think of our schedule as having a left side and a right side. Okay? Left side and a right side. Now, I'm going to go over my screen now so that you understand exactly what the left and the right side looks like. To the left, okay, of my hand and possibly left of your screen as you're viewing is production. Production meaning this is where all the work that Dr. Bumi does or any doctor does is done. And this is where you have my crown and bridge, implants, crowns, anything that is scheduled, especially for a patient of record, goes on the right side of my screen. Okay. And typically, this is appointments that are made by the team in the office. They know what the patient needs, they know how much time is necessary for this, they know what is required because some of these things may require doctor and the team to prepare stuff. So, for the virtual team, especially those who are working with us over the phone, you really don't have to worry about the left side of my screen. There's production there, which we call the primary production column, and then there's a secondary or tertiary production column. We'll train you on what these look like in the future because you may have some responsibilities with this schedule sometime in the future. Now, we're going to go over to the right side of my screen. The right side of the screen is where we see all the opportunity. Opportunity because this is where we put the new patients and we put all of our hygiene patients. And I'm expecting our virtual team to have a good mastery and understanding of what goes on the right side of the screen. So I'm going to walk you through it. Right here is where we have the new patients, and there we have Medicaid. Both patient types are likely going to be new patients. Okay, we've just made a distinction because we just signed up for the Medicaid program and we realized that they need to be put on the schedule and be done so in a very effective way. I'm going to start with the patients of record, especially the commercial patients or the patients who do not have any form of public aid. When a new patient calls, we have openings in our schedule at 8 a.m. in the morning. We also have another opening at 10. We also have another opening at 12 noon. We would have our lunch between 1 and 2. Then we have another patient opening at 2, and we have another opportunity at 4. So essentially, we have five opportunities for new patients at 8, at 10, at 12, at 2, and at 4 o'clock. All the new patients, especially, and I repeat, especially patients who are not Medicaid, will fit into this column. Now, if a patient is a Medicaid patient, we will still accommodate them, but we're likely going to put them in another part in our schedule. And this is the Medicaid only portion. Okay? So when a patient has Medicaid, we typically make appointments for them on the Medicaid only portion, but we make a slight variation. Those patients will typically come at 9, but instead of waiting for an hour for these patients, we have an extra, we make the appointments for 30 minutes, then at 9:30. So 9 o'clock patient, 9:30 patients. Obviously, we're not going to make another appointment here because there's already a patient here. We'll make another one for 11 and 11:30. We make another appointment. Obviously, we don't want to do it through lunch. We make another appointment from 3:30 to about 3:30, and another one from 3:30 to 4. And that's where we accommodate our Medicaid patients. Hygiene patients are usually patients of record who are calling to schedule, or sometimes if a new patient calls and they definitely need hygiene and we think we might be able to accommodate them, we may sometimes take the liberty to put such patients in the hygiene column for the patients of record or new patients. So I'm going to repeat. Our schedule has a length, meaning the first patient at 8 and they're out of the office by 5. And our schedule also has a width, meaning how much can we accommodate. And in the width of our patients, in the width of our schedule, we've got the left side, which is usually our production, and we've got a right side, which is usually new patients and all the opportunities we have. And within those opportunities, you have patients who get scheduled for hygiene, and usually they are patients of record that we're trying to get their cleaning done. And closely to the left of those are new patients that we try to accommodate. And I walked you through the hours of that we'll be able to accommodate these patients, usually for 1 hour. And it is 8 a.m., 10 a.m., 12 noon, 2 p.m., and then 4 p.m. And that's where we accommodate the new patients. Now, let me walk you through a fictitious patient who comes into the office and what you're expected to schedule them for. So I have Miss Jane Doe's patient. It doesn't show up on my schedule here that she's a patient of record. So I'm going to assume Jane Doe is not a patient. I'm going to click. So Jane Doe is not a patient, and I'm going to add Jane Doe as a patient. So Jane Doe has been added as a patient. While I'm still talking to Miss Jane Doe, I'm going to make sure she's female. She tells me she's single. We're going to assume her date of birth is, I'm going to think she was born probably the same date in 2000. Miss Jane Doe, to keep it simple. And I'm going to click OK. Before I get off the phone, obviously I want a number for Miss Jane Doe. In our office, the home phone and the cell phone in 2023 is almost the same thing. So I'm going to get 219-876-5555. You know what? I'm just going to keep it simple. 7777777. That's Miss Jane Doe's number. And I'm also going to put it here, 219-7777777. That's Miss Jane Doe's number. And she lives in 1234 Aberdeen Court. And she lives in the city of Munster and in the state of Indiana. And our zip code is 46321. I make sure we try and get an email from Ms. Jane Doe just because of some of the messaging that we'll be able to send to her. And I'm going to say she's abcd@gmail.com. And I'm going to click this. Now, I have created a chart for Ms. Jane Doe. And what kind of appointment am I going to make for Ms. Jane Doe? Usually this will pop up. I'm going to assume that you're going to get all the information for this thing. You are going to make a comprehensive exam, and this is the first one. Fork bite wings, prophy, and x-rays. Okay, the very first one is what you make for them, and I'm going to click on this. Okay, I clicked it twice and it came up twice, so that came up twice. I'm going to unselect one of them. So I'm going to control and unselect this. I don't need this. And everything that I am unselecting are things that I do not need. So that when my patient comes in, she's going to be coming in for a comprehensive exam, which is highlighted. She's going to come in for x-rays, and she's going to come in for a set of bite wings and prophylaxis, just in case doctor is able to do it. To that appointment, I'm also going to add the fluoride adult because she's an adult. Okay, so typical new patients, we're going to assume we'll be doing their cleaning. We may not be able to get to it, but we just kind of make availability. We make plans for those types of things. And it's going to be a comp exam, 2 periapical x-rays, a 4 bite wing exam, prophylaxis, and the topical fluoride. I'm going to click OK, and that shows up on my schedule. Now, this is not showing up at the 8 o'clock hour. I'm going to move it slightly. Good. And I move the appointment, and that's it. So that's Miss Jane Doe's appointment. You can see it says she's a new patient. I see she's coming in for a comp exam. She's going to get some x-rays. She's going to get a prophy and some varnish. And visually, when the clinical team looks at that, we see that Ms. Jane Doe is a new patient. We see everything that she needs or that should be done for her. I would expect the team to also put some com log notes, and I'm going to click on this appointment so that way, while you are having conversation with Ms. Jane Doe, she hasn't had a cleaning in a while. I want to see Miss Doe is looking for a new dentist and has not had a cleaning in 5 years. Very important, because certain patients will definitely want their cleaning on the day of, and it's good for the clinical team to know, so that while we're confirming the appointments and having these conversations with Ms. Doe, we can let her know what's possible on the day of or what's not. Now, I know your clinical leads or your business leads will tell you how to verify insurance and all those things, but for us clinically, we want to know what the patient is coming in for, and we want to know exactly if there's anything we need to be aware of. If you have any questions, please do not hesitate to talk to your clinical leads or ask me any questions. Thank you, and that's it. Morning, and that ends at about 1. We'd have lunch between 1 and 2. Then we have an afternoon session that runs from 2 to about 5. Those are the hours that we like to work. And when you look at all those hours, it ends up being about 8 hours. Now, how are the columns divided so that it'll be easy for you to think about the schedule? The first thing you need to know is we have operatories that we've designated for the doctor. So I'll have you look here to the most extreme left of my hand or your screen. You're going to see Dr. Bunmi production. The only thing that we expect to have in the big primary production column is things that we consider big production. And in our office, we've decided that that is anything that is $1,000 or more. So big production is anything that gets scheduled here is scheduled for $1,000. This is also Dr. Bunmi production, and this is usually where much of the team members in the office will put the new patients. They will put them, not new patients, I'm sorry. This is where we're going to be scheduling patients that we consider production, but this is usually less than $500. For the new members of our team, this is where you're mostly going to be working, and this is on the left of my screen. Okay, we've got a column that says Medicaid only, then we have a column here that says new patients, and we have a patient there that says hygiene. So I'm going to repeat that. If you have to look at our schedule visually, you're going to think about it in 2 parts. To the left of my screen, it is production, and this is usually appointments that are made by the team members that are physically in the office. To the right of my screen, and it'll be right here, you're going to be scheduling either Medicaid patients, new patients, or patients of record who need hygiene. This is where most of the patients' calls that come in will be placed. Now, Let me start with the easiest one, which is the new patient. So assuming a patient called us today, her name is Jane Doe. So Jane Doe calls the office and she's trying to see if she can be a patient in our office, and we're trying to get her scheduled. Um, After you go through the great call process and you ask all the questions that you may need, what you want to do is you want to look on the schedule and look for a time for us to fit Jane Doe in. Okay? Now, the team is trained to put patients at certain times of the day, and I'll walk you through them. When you're looking at the schedule, the best times to put patients into our schedule is 8 a.m. in the morning. We have an hour open here, 10 a.m. in the morning. We have an hour break, and 12 noon. Okay, so if a new patient called today and you're trying to get them into our office, you should be looking in the new patient column and you should be thinking of an 8 a.m., a 10 a.m. appointment, or a 12 noon appointment. Like I said earlier, we have a 1 p.m. break. We also try to schedule patients right after lunch at 2 and also at 4, just before the end of the day. So essentially, when you're thinking about new patients, there is 5 opportunities for us to get new patients in. 8, now 8, 10, 12, 2, and 4 o'clock. Those are the places we put the new patients. And these are patients that, even if we're not sure of insurance status, this is where we typically put them. But in the office, we kind of make a mental note that these are usually commercial insurance patients. Okay. So if a patient called and they were not Medicaid, they'll go into that new patient column and they'll fit into any of those schedules. Now, assuming while you're making the call for Jane Doe and you realize that Jane Doe is a Medicaid recipient and they're looking for an appointment, you're typically going to make that appointment for the Medicaid column. Now, in our office, you make Medicaid patients appointments for 30 minutes. Why do we make it for 30 minutes? Because we realize that sometimes Medicaid patients may not be able to make the appointment and we don't want to save time that they or may not show for the appointment. So typically we would have you do those appointments at 9 o'clock, right about here, and another one at 9:30. Essentially, if a patient calls, you make one for 9 o'clock and another one for 9:30. If another Medicaid patient called, it will be between 11 o'clock and 11:30, and obviously we'll be on lunch from here, and the next opportunity will be between 3 and 3:30. And those are your new patient calls for the new patient. Hygiene patients are usually patients of record who are trying to get scheduled for hygiene. Once you determine that they've been the patients in our office, they can be scheduled in the hygiene column. Okay, so that's the basic framework for where we can put patients in our office, and those are the times we can put them. If you have any questions, the office managers will be able to guide you and show you how these appointments are made. Thank you, and bye.